In this lecture we are going to look the introduction to pharmacology. So let's get right into it. General pharmacology. Pharmacology, it's the study of substances that interact with living systems through chemical process, especially by binding to regulatory molecules and activating or inhibiting body process. Or, it is the science that studies the effects of drugs within a living system. It deals with all legal and illegal drugs, including the street prescription and over-the-counter drugs and complementary medicine. Basic areas of pharmacology are 1. Pharmacokinetics. 2. Pharmacodynamics. Now let's define them. Pharmacokinetics deals with liberation, absorption, distribution, biotransformation and excretion of drugs, while pharmacodynamics is the study of biochemical and physiological effects of drugs and their mechanisms of action. Definitions of common terms. Pharmacotherapeutics, use of drugs in prevention and treatment of disease. Toxicology, it is that branch of pharmacology which deals with the undesirable effects of chemicals on living systems, from individual cells to complex ecosystems. Drug is any substance that brings about a change in biologic function. Any substance used in diagnosis, cure, treatment or prevention of a disease or condition. Chemotherapy is the effect of drugs on microorganisms, parasites and neoplastic cells living and multiplying in living organisms. Indication is an illness or disorder for the treatment of which a specific drug has a documented usefulness. Contraindication is a health condition/state that would preclude the administration of a drug, e.g. aspirin is contraindicated in peptic ulcers. Half-life or half-time, T1/2 is the time taken for plasma concentration of a drug to fall by half or 50% following its elimination from the body. It enables one to maintain a steady state/critical plasma concentrations of a drug in which there is maximum therapeutic effects and minimum adverse effects. It determines the frequency of drug administration. Pharmacogenetics is the study of the effects that genetics have on an individual's response to a drug. Drug interactions is the effect produced when some drugs are given together and in the course of their action they alter each other's duration and magnitude of pharmacological action. Intolerance is low threshold to normal pharmacological action of a drug. A drug causes an exaggeration of a normal pharmacological response, e.g. morphine may cause coma instead of respiratory distress, which occurs with administration of a normal dose. Tolerance is the decreased response to a drug as a result of continuous exposure at the same dose or need to increase the dose of a drug to achieve the same effect. There are three basic types of tolerance. 8. Metabolic or pharmacokinetic tolerance. This occurs due to increased biotransformation or metabolism of a drug leading to reduction in drug concentration at the receptor site. B. Cellular or pharmacodynamic tolerance. This type is caused by adaptive changes that take place at the receptor site or systems closely connected with drug action sites. C. Cross-tolerance, where tolerance to one drug confers tolerance to another. Drugs that have the same chemical structure tend to portray cross-tolerance, e.g. people tolerant to one barbiturate are usually tolerant to all barbiturates, e.g. phenobarbital, butobarbitol, thiopentol. However, drugs of the similar class can also portray cross-tolerance. Iatrogenic responses. These are responses produced unintentionally during the treatment of client, e.g. penicillins may cause hepatic toxicity, steroids may cause Cushing's syndrome. Pharmacognosy, a study of drugs that come from natural sources, e.g. plants, animals, and minerals. Receptors, the component of a cell or organism that interacts with a drug and initiates the chain of events leading to the drug's observed effects, therapeutic or adverse, is called a receptor. Agonists, these are drugs that bind and activate receptors because they resemble the natural chemicals and produce the same effects as the natural chemicals. Antagonists, blockers, these are substances/drugs that are sufficiently similar to the natural substance to be recognized by the receptors and to occupy them without activation, thereby preventing, blocking, the natural substance from exerting its effect. The antagonists that have completely no activating effect are called pure antagonists. Others exert low-degree activation and are called partial agonists. Inverse agonists, these produce effects that are specifically opposite of those produced by the agonist, e.g. benzodiazepines act on benzodiazepine receptors to produce sedation, anxiolysis, muscle relaxation. A second example is where adenosine binds to adenosine receptors to produce drowsiness, whereas caffeine binds to the same receptors to produce alertness. Potency, this is the amount weight of a drug in relation to its effects, e.g. if weight for weight drug A has greater effect than drug B, then drug A is more potent than drug B, but the maximum therapeutic effect obtainable may be similar with both drugs. For instance, the diuretic effect of 1 mg of bumetanide is equivalent to 50 mg of furosemide, hence bumetanide is more potent than furosemide, but both drugs may achieve the same maximum effect. Therapeutic efficacy. Therapeutic efficacy is the capacity of a drug to produce an effect, and it refers to the maximum effect, e.g. if a drug A can produce a therapeutic effect that cannot be obtained with drug B no matter how much of drug B is given, then drug A has the higher therapeutic efficacy. Dependency is the state arising from repeated periodic or continuous administration of a drug that results in harm to the individual and sometimes society. Persons feel a desire or a compulsion to continue using the drug and feel ill if abruptly withdrawn or an antidote is used. Substances that cause dependence are taken to induce good feelings or avoid discomfort of their absence. Types of drug dependence. There are two types of dependence. Psychological dependence, usually first to appear, where individual has a craving for the effect or response that the drug produces. Emotional distress like fear, anxiety, and irritability occur when the drug is withdrawn. Physical dependence. This dependence is usually defined in terms of withdrawal or abstinence syndrome that are physical in nature, i.e. there is physical illness that accompanies withdrawal. History of pharmacology. Prehistoric people recognized beneficial and toxic effects of many plant and animal materials. Preceding the modern era, there were attempts to introduce rational methods into medicine. Around end of 17th century, reliance on observation and experimentation began. About 50 years ago, controlled clinical trial reintroduced the expansion of research efforts. Drugs. Drugs mostly interact with a specific molecule in a biologic system that plays a regulatory role, receptor. To interact chemically with its receptor, a drug molecule must have the appropriate size, electrical charge, shape and atomic composition. Source of drugs. 1. Mineral liquid paraffin, Mg trisilicate. 2. Animals, insulin, heparin, thyroid. 3. Plants, morphine, quinine, digoxin. 4. Synthetic, asparine, atropine, castor oil. 4. Microorganism, penicillin, streptomycin. 5. Genetic engineering, human insulin. Drug nomenclature. Existence of many names for each drug causes lamentable and confusing situation. Chemical names. Non-proprietary/generic name. Brand name/proprietary/trademark/trade name. 1. Chemical name. The chemical name is a scientific name based on the compound's chemical structure, e.g., 6-thioguanine, and is almost never used to identify the drug in a clinical or marketing situation. Often, the name is long and difficult to pronounce, and since it has numbers, the number in the name might become confused with the numbers in the prescription. 2. Generic name. The generic name or non-proprietary name is commonly used to identify a drug during its useful clinical lifetime. The generic name does not belong to the company that discovers the drug or owns the patent. Once the patent lifetime is expired, any company may market the drug under the generic name. Used by all who wish to refer to this substance. Serves as an important and unique designation for the active ingredient. It appears with the company's trade name on drug labels, advertisements. Authors use generic name in clinical trial reports and hence used in publishing scientific data about investigational and established therapies. Much shorter, easier to remember and pronounceable than the systematic chemical name. 3. Brand/trade name. The company that patents the drug creates the brand name, trademark. This name identifies the drug during the 17 years that the company has exclusive rights to make, sell, and use it under patent law. Drugs are often designated with a registered trademark, for example, Cimzia, Keppra, Xyzal, Xyram, and Nupro. A drug may have more than one brand name. Brand names and generic names for active ingredients. Brand, Cialis. Generic, Itadalefil. Brand, Colmin, Lipex, Zocor, Vitarin. Generic simvastatin. Brand Glivec. Generic imatinib mesylate. Drug development. After a chemical that might have a therapeutic value is identified, it must undergo a series of scientific tests to evaluate its actual therapeutic and toxic effects. This process is controlled by legally established bodies, e.g. Pharmacy and Poisons Board and Food and Drug Administration, FDA, in Kenya and US respectively. For every 100,000 chemicals that are identified as being potential drugs, only 5 end up being marketed. Before receiving legal approval to be marketed to the public, drugs must pass through several sequential stages of development as shown. Preclinical trials to phase 1 to phase 2, phase 3, then to phase 4. 1. Preclinical studies in animals. This phase involves testing of the drugs on laboratory animals to determine if they have presumed effect in living tissue and evaluate any adverse effects. In general, the tests undertaken include pharmacodynamics, pharmacokinetics, and toxicology. The goal of preclinical toxicity studies include identifying potential human toxicities, designing tests to further define the toxic mechanisms, and predicting the specific and most relevant toxicities to be monitored in clinical trial. Toxicity studies include mutagenic potential. In this study, the effects of the drug on genetic stability of bacteria is conducted. Some mutations in cells result in development of cancer. Carcinogenic toxicity may not be necessary unless the mutagenicity studies were unsatisfactory. It is usually done when a drug is intended for prolonged use. Reproductive toxicity studies are done to find out the effects of the drug on fertility, implantation, fetal growth, teratogenic effects, and neonatal growth. These have to be extensive because of the diversity of physiological processes that may be affected. 2. Phase I, clinical pharmacology. In this first phase, human volunteers, usually 20, 50, healthy volunteers or volunteer patients depending on the class of drug and its safety, are used to test the drug. In this phase, the pharmacokinetics and pharmacodynamics of the drug are tested. This is done in tightly controlled studies by specially trained clinical investigators. Ethical principles need to be considered since one is dealing with human beings. Reasons drugs may be rejected at phase 1. At this stage, drugs may be rejected for the following reasons. 1. Lack of therapeutic effect in man. 2. They may have severe adverse effects and or be too toxic. 3. If discovered to be teratogenic. 3. Phase 2, therapeutic exploration. In this phase, clinical investigators test drugs in patients who have the disease that the drug is meant to treat. Usually 100-200 patients are involved in the study. Pharmacokinetics and pharmacodynamics are determined as well as dosing requirements and efficacy of the drug at the given dose. Ethical considerations are again adhered to. After phase 2 studies, a drug may not be moved for further investigation for the following reasons. 1. If the drug is less effective than anticipated. 2. If it is discovered to be too toxic when used in humans. 3. If the drug is likely to produce unacceptable adverse effects. For drugs with low benefit-risk ratio, i.e. therapeutic benefits do not outweigh the risk of potential adverse effects. 5. If it is not more effective than other drugs already in the market, making the cost of continued research uneconomical to the company. Drugs that show promise of a therapeutic agent go to phase 3. 4. Phase 3, a therapeutic conformation. After the second phase, the drugs are taken to the third phase whereby they are used in a vast clinical market. 300 to 3,000 patients are involved in the study. Prescribers are informed of all known actions of the drug and precaution to take for its safe use. It's important to note that unexpected responses may occur in wide use of a drug. 5. Phase 4. After a drug is approved for marketing, it enters a continuous evaluation phase, phase 4, which goes on for unspecified duration of time. Prescribers are expected to report to the regulatory bodies any unexpected effects which then evaluate this information. After wide distribution, some unexpected effects may occur, e.g. antiparkinsonism, amantadine seen to have antiviral effects and therapeutic effect. A drug may be withdrawn from the market if it produces toxic effects, e.g. thalidomide. Prescription writing. Medication orders written on patient's record by the physician over prescription blank or on patient's medical records. There are two forms of prescriptions formats. 1. Blank prescription given to ambulatory clients to purchase from pharmacies. 2. Orders sheet given to patients in institutional settings. The pharmacist receives the orders in print or electronically. Elements of a prescription order. The elements are associated with the rights of drug administration. All parts of the order should be legible and clearly expressed. Any clarification should be made to the prescriber who wrote the order. It is the responsibility of the healthcare practitioner to check the medication order for completeness. Elements of prescription writing. 1. Date can be in generic or trade name. 2. Patient's name, right client. 2. Drug name, right drug. 3. Drug dosage, right dosage. 4. Drug frequency, right time. 5. Prescriber's signature, right documentation. Other than the elements, one should check the concurrent drug therapy, drug/drug food interactions. Can they contribute to toxicities? What are the baseline clinical assessment is required for the drug therapy? E.g. pulse rate for digoxin. The baseline could include laboratory test for blood count, renal/hepatic function. Prescription writing. The health worker should question any omission, discrepancy, or unusual order. A blank prescription will contain the physician's reg number, especially if the drug is a controlled substance, and the number of times it will be administered. It is required that the prescription is legible and the quantity to be properly written. The prescriber must put their name and countersign. Types of drug orders. 1. PRN, as needed order. 2. Start order, single dose immediately. 3. Single order is an order for drug to be administered only once at the time indicated. I want to stop there for now. Thank you for watching. I hope you found this video useful, and always stay tuned for more videos.